Hello and welcome to this episode this week. This is Dr. Aurora Maranga from Janis Hospital, Nairobi, a consultant gynecologist and cancer specialist. Today I'd like us to talk about something which almost every woman goes through. Actually, every woman goes through during their lifetime, and that's ovulation. Remember, ovulation is central to reproduction. There are times when women are keen to conceive, there are times when they are not keen to conceive. So either way, it is important for you and every woman to know when they are ovulating and probably when they are not, because then that helps. Now, today about ovulation, we're going to look at what are the signs of ovulation, when is it likely to occur, and when to time for conception, and when to avoid a conception. And remember, there are also many women out here who use the natural family planning, where they would look at when they're ovulating, and therefore, if they're not keen on ovulation and on conception, they are able to plan their families better without even using the other conventional family planning methods. But of note is for such to occur, one must have a very regular cycle. A regular cycle is anything between 21 days and 31 days, but majority of women would generally have their cycle as 28 days. So for today, we're going to talk about a 28-day cycle for ease of explanation. But of course, we are aware others could be having the differences out here. So when is ovulation? Or let us start from the start. What is ovulation? Ovulation is when the egg is actually released. And the egg is being released from the ovary. We have the ovaries, and then there's the ovum. Ovum is the egg. And I find it very interesting when I engage my patients occasionally about when they ask me where are these eggs when they are not utilized for that particular cycle, where do they go? And my common question it would be like, how big do you imagine or how small do you imagine the egg is? And I get very varied answers. There are those who imagine it's a big thing, like maybe a chicken egg. There are others who would say maybe much smaller than that. Others would be like, for it to make a baby, it must be as big as an ostrich egg and all that. Imagine all those are the answers. Understandably so. But do you know the truth? A human egg is one cell, which is actually carrying half the genes of the woman. So it's actually one cell. So it is very, very microscopic. So this egg is actually released during ovulation, and it is released on the 14th day of the cycle, most of the time, 14th day for a woman who has a 28-day cycle. Of course, if the cycle is different, then it will be a different date, but it will be mid-cycle. Mid-cycle just means you have, and I'm going to demonstrate, you have the start of the period, you have the end of the cycle, that's the beginning of the next period. So when the period starts, that is day one. And when the period starts, the next period starts, that is the end of that particular period. And that is what we are calling the cycle, which is most often 28 days. So in between there, mid-cycle, that is when ovulation occurs, most often day 14. And for fertility purposes, usually we add and subtract 3 days on each side of the 14th day. So you're talking about day 11, 12, 13, and you're also adding 15, 16, 17. I hope I haven't lost you. So those are the days which we call fertile days. So if a woman is active during that time, then she is likely to conceive. If one is not keen to conceive, then avoid those particular days from day 11 to around that days 17 or thereabout. And during that time, be sure to use other alternative methods to avoid a conception. But of course, if you're keen on conception, then that's the right time. So what are the symptoms, apart from knowing the date and knowing your days? What are the symptoms of ovulation? They are varied and they are different in different individuals. There are those who will have very subtle, very few, and very little symptoms, while there are those who will have very exaggerated symptoms. But all in all, one would see that there is difference in the caliber or in the character of the vaginal secretions or vaginal discharge, as we call it out here, which would generally be more like mucoid, watery, thin, and more often than not, it's actually more than during any other time of the cycle. So that's the type of discharge, but don't confuse that with an infection. Infection usually there is a foul smell, there's a bit of itch and all that, and the timing has to be around mid-cycle. And apart from that, some women may experience a bit of pain from either side of the lower abdomen, a bit of cramping. And that is because the egg is being released from that particular part. You can actually tell that it's on the right or it's on the left because of some pain which may occur. It may be a flash, that's like a stitch, which takes a few seconds, but in others, it may take even a day or two with those particular symptoms. They are recognizable. Some women will have that. Some other women may actually not have that particular type of pain. So those are the main ones. Others may have different symptoms in their bodies, like some breast sensitivity, nipple sensitivity. But those are usually fewer women who would have those particular types of symptoms. Now, having known about that ovulation, we have talked about when ovulation does occur, the symptoms of ovulation. And of course, the usefulness of that is once you know when you are likely to ovulate, you understand your body better, you understand about your fertility, and then you can make your own decisions on what you want to do during that particular time if you're interested in fertility or if you're not really interested in fertility. So today was to simply touch on something which happens every month for almost all the women, and that is ovulation. But before we finish, let's look at does it mean that if you're having your regular cycles, you're actually having ovulation every month? Far from it, apparently. And there are some months which you will go without ovulation. And that could be due to hormonal imbalance. Hormonal imbalance could be due to some conditions where the ovaries are enlarged and they have cysts, so we call it polycystic ovarian syndrome, or other reasons of hormonal imbalance, like a lot of stress, somebody has been bereaved, or somebody has traveled, has changed climate. Those changes, the body might react by skipping an ovulation. So, or maybe some medications which somebody is using, and of course, more obviously, it's some of the contraceptives like the pills. When one takes the pill, the daily pill, or if somebody is on implants like Jadel or Implanon, or is taking the injections, the hormonal contraceptives, so to speak, those ones will make ovulation not to occur. So, our viewers, we've come to the end of our talk today. This was Dr. Aurora Maranga, consultant gynecologist and cancer specialist in Nairobi. Remember to subscribe and share. This information may assist somebody out there. See you next episode.